Are you ready to embark on a journey of success? To discover your true potential in the untold stories of careers in life sciences? Welcome to PATHFINDER by the Purdue Institute of Inflammation, Immunology and Infectious Disease. With your host, Tommy Soares, discover the untold stories of industry scientists and unveil the secrets to excelling in your career. Thank you for joining us once again, and remember to hit the like button and subscribe to our channel. Welcome, everybody. My name is Tommy Soares. I'm the Director of Scientific Strategy and Relations for the Purdue Institute of Inflammation, Immunology and Infectious Disease. And today on Pathfinder, I have the pleasure of welcoming Qing Li, who is the Vice President of Strategy at Blue Agilis, where she develops strategy and infrastructure for commercial viability. Blue Agilis is a 3-year-old health tech startup based out of Indianapolis. Qing's interest in the health sciences and healthcare delivery started at an early age. Her career has taken a winding journey through traditional healthcare fields, but is always guided by the allure of interesting problems to solve, developing innovative systems and technologies, and implementing life-changing solutions in the real world. Qing has peer-reviewed publications in chemical engineering, management science fields, but now finds fulfillment in commercializing and promoting great ideas and products. Welcome to the program, Qing. So happy to have you on Pathfinder today. Thank you for joining us.
Yeah, thank you, Tommy. I am going to have to correct you a little bit there. It's Blue Agilis and not Blue Agilis.
Okay, Blue Agilis. Great.
Yes, yeah.
So Agilis for agility,
Agile.
maybe? Agile, yes.
Yeah.
Perfect. I like that. I like that. I'm so interested to hear a little bit, obviously, about what Blue Agilis does and what your role is there. But perhaps you can take us, from as early as you want to take us to what was your start like in your career and what got you into this field. And we want to hear it all, because I understand that you have always been essentially related to healthcare fields, but not necessarily your upbringing or your career development has not necessarily been all in the scientific field. So I want to hear a little bit about how you shifted around, what was the inspiration to go in either direction, and we want to hear it all.
Yeah, actually, I'm so glad that you're doing this series because it's helping to expose different career paths, right?
Yes.
And I really credit who I am today and where I am today to those people who exposed me to new ideas or challenged my existing way of thinking. And those ideas usually took me off the well-beaten path onto a whole new one that had a lot more adventure in it. And so I'm just really grateful for people like you who are helping folks see other sides of healthcare and other sides of careers.
Well, thank you for that feedback. I just wanted to say that, but please go on.
Yeah, I was gonna start saying, I sit in the healthcare startup world today, specifically focused on commercial viability and strategy. And for those who don't really understand what that jargon means, to put it simply, it just means turning an idea or a product into something that makes money and wins in the market or captures more customers than competitors. And that's a one-dimensional way of explaining it. The reality of taking ideas or products to market, especially in a market like healthcare, is a multi-dimensional problem with a complex networks of levers to pull. And it's an ever-evolving system with not well-defined objectives, which it keeps me interested. And how I ended up here really started with the last fork in the road in my career journey. I was faced with the challenge of trying to make heads or tails of the statement, Qing, your work is really good, but it's too academic. Be more commercial. And so that transition from my academic background into the commercial corporations was not really going so well at the time. And for me, I had no idea what commercial even meant. And it was difficult for me to even get an answer from someone to give me a clear definition of what it meant. And for my engineering brain, I was really confused and lost around how I could build towards something that I can't even define. And so I spent several years trying to figure out what commercial actually meant and how one builds towards it in different contexts and environments, and became a bit obsessed with that idea of trying to figure out what it is. And funny thing is that I think where I landed was, even though my approach to day-to-day work at the time wasn't commercial, wasn't deemed as commercial. When it came to my major career choices and decisions, my mental model of what I wanted to do and how I'm going to get there, it actually was surprisingly commercial, even though I didn't have the vocabulary to describe it at the time. And so, taking us back to the beginning, I really credit the beginning of the formation of my mental model to a high school econ class that challenged us to think differently about the world and the problems in it. One of the required readings was Freakonomics, written by Stephen Dubnar and Stephen Levitt. And I think their subtitle is something along the lines of like, think differently and understand the hidden side of everything. And that became my mantra in high school. So when it came to choosing a profession at the young age, at that younger age, I had always wanted to go into medicine. I had an aunt who was I had an aunt and uncle who were doctors, and I don't know, I love playing with their medical toys. Well, I thought they were toys, their medical tools. And I just really, I gravitated towards the idea of helping people feel better. But when I took that econ class, I knew that there was so much more to healthcare than just providing medical care. And I took to that econ class a lot more than I did to my STEM classes. And because of that narrow exposure to that kind of thinking, I narrowed down my university choices to give me both the opportunity to go to medical school after college, and then having and then also schools that had a strong econ department or management schools. And so for my academic years, I had the great opportunity to attend MIT, Georgia Tech, almost went to Purdue, did a short stint at Technion Israel Institute, took some classes at Harvard, Georgia State. Through those experiences, I had a great pleasure of meeting so many extraordinary individuals. And but entering into higher education, I was honestly just incredibly intimidated by those incredible individuals and by the academic rigor of my classes. And so at the time, because I didn't really understand the other career options in healthcare, and I knew I didn't really want to go. I mean, I was still, flirting with the idea of going to medical school, but I wasn't set on it. I drifted a little bit aimlessly in those first couple of years doing research in various labs, continuing to learn about healthcare and how healthcare works. But I just had this gut feeling that, like the stories that was in Freakonomics and these stories that Stephen Dubnar, Stephen Levitt wrote about, there was more to the truth about healthcare and the incentive systems inherent to healthcare that meets the eye. And I really wanted to learn about those truths. And but I didn't know who would be able to guide me down a path where I could learn those truths. I didn't know who, like, I didn't see anyone in my traditional majors who really saw it like I did. And 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 so as most things do in life, happy happenstance occurred in my junior year. I caught up with my graduate student assistant on my in my dorm at the printers one night. 1 a.m. We were just printing out homework or whatever, and I was trying to just make light conversation with him. I asked him, "Hey, I've been on your floor for a while. What are you actually doing at MIT?" And what he told me blew my mind. He said, "I am studying and researching how to optimize emergency departments so that patients could get through the emergency department door to door as efficient as possible." I was like, "What? No, like, you're kidding." Like, this is exactly what I want to do. This is exactly, what I want to hear. And that 15-minute interaction just changed the whole trajectory of my life. That was the first time I heard someone talk about healthcare like I thought about healthcare. And I basically just begged him to tell me everything he knew, introduced me to all of the people he knew. And it was the first time I felt like alive, just consuming everything I could on that topic. And that's what I did for several years. And so when it came time to step out of academia and to make that first jump into getting a big girl job, I had to make a couple of decisions about my career in medicine. And I said, you know what? I was never made for the structure of school anyways. And the prospect of so many years of schooling was just really hard for me to imagine doing. And so I was like, you know what? No, I'm not going to do this. And also, I think the joy of like practicing medicine wasn't what was attracting me to healthcare in the first place, right? It wasn't about like the practice of medicine. It really was about fixing the state of healthcare delivery that was interesting to me. And so I said no to medical school, and I got jobs in process engineering or quality and improvement, process improvement in health systems. Spent those first couple of years doing that. It was great. Exposed me to so many different corners of the healthcare delivery system. And then I saw a couple of things in the market colliding. This is about 10 years ago. And I started having this nagging question of the work I was doing with process improvement, quality improvement, systems engineering was around patching and fixing the same processes over and over again. And I was like, well, I mean, we could do that. We could put Band-Aids on things, but I feel like sometimes what we actually need to do is scrap whole pieces of what we're doing and start anew, right? And I was really, there's this allure to innovative technologies. And so I was thinking, well, maybe it's not a process fix sometimes. Maybe what it is that we need to bring in technology that can actually do things better, faster, and ease frictions in communication. And what was happening 10 years ago, if any of your viewers were around to see what was happening in the innovation space, but funding and innovation globally went from, in 2011, this is mind-blowing. Like the statistics on this is like crazy. In 2011, globally, there were only a couple $2 billion invested in healthcare innovation. 2021, 40 billion. I mean, that is insane, right? And so I was kind of on that early couple of years where there was just money flowing into innovation. And so a lot of people, the popular thing to do was to get out of college, get out of grad school, or even in grad school or in college, start a startup company right? And then a lot of them were in healthcare. And so I got really interested. I didn't make that jump. I personally I went the I tried to go the traditional, get a job route. But I was very interested in following those early stage startups,
Yes.
hearing from my friends how they were starting from ground zero, growing them, and then hearing about the challenges that they were facing. So one of the common themes I had heard from them, product and idea excellence aside, was that many of these founding teams were made up of incredibly smart technologists or practicing physicians who had a hard time taking their brilliant idea and then convincing healthcare ecosystem to buy it. So I mean, there's a lot of reasons, right? Like, why is that? Like, there's a lot of reasons, but that question of why and how do you bring more innovation into healthcare? Because as we all know, healthcare is just one of the it's especially in the US, it's such a lagging industry, a lagging market for technology and innovation. And I was really compelled to understand why. So I spent a number of years researching healthcare startup space. I was actually lucky enough to have a job literally doing that. I was the market insights lead, and so I was evaluating the strengths of companies and teams, their ideas and their products, and then understanding how the healthcare delivery systems actually adopted these innovative technologies. And so being able to dive into that intersection between innovative solution providers and then the healthcare delivery buyers opened up this whole new world to me. That exposure brought me out of my comfort zone in academia. As a scientist, as an engineer, it challenged me in ways that I didn't know it was possible. It challenged me to be okay with moving forward with just an inkling rather than having the perfect idea or perfect solution for things. And it ultimately led me to that moment that I had shared in the beginning about being told that I needed to be more commercial. But once I did find good footing around understanding that seller buyer dynamic in healthcare, I started to wonder, some solution providers are more successful than others. Are there key operational characteristics that made them more successful? And then conversely, some solution providers ultimately failed. Actually, a lot of solution providers actually fail, which people don't talk about, but there's a lot of failures in the startup world. And the funny thing is, founders are often they're very unique, right? They live in a world in their of their own sometimes.
Yes.
And when you ask them, why did your startup fail? Usually, a lot of times, they'll chalk up their failure up to the market not being good or something catastrophic happening, and it's never about the operations of their company or how they ran the company or whatever, right?
Yes.
And so of course. And so I kind of became interested in, what are those key operational characteristics that leads to success or failure? And I, as I mentioned earlier, the reality of all of this is that there's so many levers to pull to find the right patterns to get the results that you're hoping for, or at least knowing which patterns would lead to failure, right? And so it's this game that keeps me going, and I keep going on searching for those answers. But I guess to kind of close the loop on my soapbox, I would say that my career decisions being commercial, as I kind of mentioned earlier in my introduction, is my career journey actually followed a pretty predictable cycle. So I would let this gut inkling really inform the initial deep research on a topic that would lead me to develop my skill set and align with, whatever problems I'm trying to solve. And then I test out those ideas. Usually, I build a network of like-minded people, or I convince someone to give me a job, whether I'm qualified or not. And then I promote my ideas and services to see what actually sticks, and innovating when necessary, and then sunsetting ideas or services I provide when they're waning or proving to be false. And then lastly, I let that next big problem or that next big idea come along and then take me back to one. And so, I really hope that your listeners walk away from my soapbox with the confidence to never be afraid to reinvent themselves, right? Like I don't think anyone I know takes a straightforward path from after high school until they're retired. Everyone goes on a winding path, and the path is, you get to choose what that path looks like. And I hope, I hope I'm giving some people the confidence to step out onto that path that might look a little scary.
I think you certainly are. And it's incredible to see you carry that confidence. Still, even though you talk about success and you talk about failures and you talk about things that you've learned, but always being curious, staying curious and staying active in your mind, listening to your mind, the best thoughts of your mind, and not letting worry or anxieties take over and stop or inhibit you from taking action and what you're supposed to be doing to satisfy that curiosity. I love that. I think that is such an incredible way of being, really. It's great. There's so much that I want to ask you, though, but so, this course that you took in economics, and it opened up a new way of looking at the world for you. I've always thought, would it be good for even us scientists who are so on track with the science to take these courses too, so that we can get the real life perspective of why the systems are built the way that they are built, why our institutions are built in the way that they're built?
Yeah, I absolutely support the idea of cross functional learning. But I think the thing is, and I've thought a lot about this, because I I might wear my anxiety and whatever well right now, but I've definitely gone through years of challenges, and I've often butted heads with my managers, and I'm a difficult person to manage. And one of the reasons is I don't like to be told to do things, right? And I think this is something that I've thought about a lot, is when you're designing course curriculums, or when you're designing certificate courses, right? One part of this is exposure to some of these ideas, but someone has to want it to even absorb it. There was this really great class that I never took, but it was in the aeroastro department at MIT, and it was a project class. People usually took it in their junior year, I believe, and I had the opportunity to talk to the person who had led that class for many years, who had designed that class from the beginning. And I had asked him, I was like, this is, your course is so popular. Like, it's hard. Everyone like complains about how hard it is, or like how many hours they're putting in, but like everyone loves it. It's like your rite of passage almost, right?
Yeah.
And and I said, well, tell me about your success and how you found success in the design, because it's not like a normal class design. He said, well, what we do, class number one is I tell the students, you will be paired up with a industry partner, and you will work on one problem that they will define for you. What do you need to learn? And he forces the students to write down, here's a list of things that I need to learn in this class to be successful with this industry partner. 95% of the time it matches up with exactly what he had on the curriculum already, right?
Yeah.
And so but like it's creating that demand up front of like the students understand, like, I want to do well in this class, and in order to do well, I personally am taking responsibility for knowing that I need to learn these things. No one's forcing me to.
Right. That is awesome. And doing that self-reflection, that exercise of saying, what do you need in order to be successful with this partnership with industry, it's maybe an activity that we should all do, and take reflection and write those lists down, because it's in writing them down that you really start going deep and start thinking or knowing, oh gosh, what are my limits? What do I need to partner on, or who can help me, or where do I gain these skills, right? So Qing, tell us a little bit about this process engineering, Lean Six Sigma, all of that stuff. It's fascinating, especially because I do understand that it is to improve the systems that are already there, and that you made a strong point of saying sometimes we need to take a look at that and say, no, we need to start from ground zero or implement a new technology. Um, what are you seeing in terms of the shift in old manufacturing industry and ways, and now new developments that do require new technologies, but having this notion that even a new technology requires process improvements all the time. So tell us a little bit about that time and how you've been able to use that in your career.
Yeah, absolutely. And by the way, I am a huge lean fan. I started at MIT, like going through those lean courses and doing learning from, like, the basically the birthplace of lean. But I think where I've gotten to with it is that there's a place and time to do process improvement and to do lean and to use the fundamentals that lean teaches you. And for an environment like healthcare, where you are where you have people treating people, it's a complex system, and complex systems are really hard to handle in a lean environment, lean mentality. And so, I think lean is great. I honestly think any kind of manufacturing environment where you're taking a machine, making widgets, they need to be operating with lean, and they need to be thinking about process improvement and all of that on a day-to-day basis. However, how I got introduced to Blue Agilis was actually I took a workshop course, 3-day workshop from the Center of Health Innovation and Implementation Science out of Indiana University. And I honestly, again, happenstance. A lot of things in my life just kind of, fall into place. But I got this targeted ad on LinkedIn saying, "Are you interested in innovation and agile?" And I was like, "Yes, I am." And it was like a pre-registration, maybe like in it was like August or something. I was like, okay, I'm gonna pre-register, see what this is about. When it came down to the course happening in December, I got a couple of emails in November saying, okay, the course is going to be X number of dollars. You could pay the fee and then you'll, get access. And I was like, I don't really want to pay the fee. And then I get an email saying, since you pre-register, you actually get this course for free. I was like, well, it's for free. I don't know what's going to happen in this course, but let me just check it out, right? Let me spend 3 days and see what this is about, because they are right. I am interested in innovation. I am interested in Agile. I want to learn more. And so I joined the I joined the workshop, and like straight away I was like, you know what, this is something different. This is I couldn't really put my finger on exactly what was different, but it was definitely different from how I had thought about improvement in healthcare, and how my existing network had thought about improvement in healthcare. And I was really intrigued. And again, happy happenstance with this course was the CEO now for Blue Agilis she never joins these. This one time she decided to join, and I met her, and I met the co-founders of this company, and this is even before they officially started the company. And so when they were saying that they wanted to take these agile concepts and take the concepts that they had created over 10-year span on implementation science in healthcare and commercialize those ideas, I was like, have you started a company before? First of all, and then second of all, I don't exactly know what you guys are doing. Like, even though sitting through 3 days, like a lot of things, interesting things are happening, but I don't know, I don't exactly know what the basis of this company is going to be. But I really want to be involved, and I really want to be able to see if I can help them commercialize these ideas and take whatever products that they have into healthcare and be able to make a difference for healthcare providers and patients. And so for me now, I really, believe in this idea that lean is great. And even in healthcare, there are times where you have to use lean. But because we are working with people, and because we are, everyone is a complex being in ourselves, the agile concepts and the agile way actually is a better model for improvement and implementation of innovation. So
can you explain to us a little bit what are some of the differences between agile and lean, or what is it about agile that makes it a better system or a more adequate system?
Yeah, well, first of all, the number one rule of agile is building a safe, psychologically safe environment for your team. That is that's the foundation of all of this. If you don't have trust, you're not going to get anything done. If you don't have trust and build relationships, right? It doesn't matter if you have the best process ever. The people who are supposed to implement it will never implement it. So that's number one. And then number two is letting go of that idea of perfect. What I just said about the best process. Well, you know what? It might be the best process that you have come up with as an engineer on paper, but it might not be the best process for the clinician who actually has to deliver care in his or her clinic. And so there's a lot of variables that are involved in understanding the core minimum, the minimum viable of what you need to be implementing, but then allowing the flexibility of your clinical environment to dictate how you actually implement this solution. And I think that's where a lot of implementation teams get stuck, honestly, with technology solutions, process solutions. They're trying to implement they're trying to force they're trying to force a square peg into a round hole and saying that you guys aren't doing it right? But they don't even acknowledge that it's a round hole.
Right, right. That's so true, right? It's very typical engineer approach. Well, I have a tool. I have what problem can I solve with the tool, right? Sometimes
Exactly.
it's sometimes looking at the problem first and then designing the tool for that problem might be the right direction. So
Yeah.
that,
And
yeah, go
let
ahead.
me follow up with that with one last thought, which is the third thing about Agile, which I think is um, helps why it's helpful in healthcare is that it's quick iterations, right? To your last point specifically about building the right tool for the problem, one iteration is not enough. One conversation with a clinician is not enough. There needs to be quick iterations. You can't wait 6 months, 12 months for that first perfect tool, because we can guarantee it's not perfect. It's not going to be perfect, right?
Right.
So it's the combination of those three things, that flywheel that has those three things, that makes it usable in healthcare.
And so it sounds to me also very much human-based design approaches, right? Where you are giving them the tool and then you're trying to get the feedback to improve the tool and make it more ergonomic for them.
Yeah, absolutely. I mean, I think these concepts can be used in a variety of different constructs. And when we're talking about innovation, it can be, taking existing processes, existing tools, and making it better, making it more user friendly, or it could be just, looking at what you have existing right now and then coming up with whole new solutions, right? It really just depends on the context and what you're actually faced with. But I think where we've landed with Agilis is that we're not really we've got a tool bag. One of them is human-centered design, right? The framework, the three things I mentioned, that's Agile. But we take in other concepts and other tools from other fields as well, behavioral economics and Lean, Six Sigma, I kind of mentioned earlier, I don't have anything against Lean. It just needs to be, utilized in the right way, right? It's not. I think where we got to in healthcare over a 30-year span was that people would jump on one train and that is all they do, right? It's like Lean or nothing. Right, PDSA or nothing, and it's like, no, like that's not reasonable, right?
Right.
And so what we're trying to do is give people, clinicians, practice managers, people who are responsible for getting outcomes at the end of the day, give them the tools, whatever those tools need to be, to succeed at the end. That's all we care about. We don't care about the tool. We care about you succeeding, right? And if the patient wins, the clinician wins, and we win. And that's how we see this.
Gotcha. It's fascinating. It really is fascinating. And it speaks to even how you explain to us your starting inklings of going in this direction of chasing this passion. And it sounds to me almost like constantly thinking outside of the box. And it seems like your motto, Qing, that you're constantly thinking about, well, what are we missing? What are we not doing? And what could we be doing better? And always trying to blend those, balance those. It's so fascinating to hear you talk a little bit about it, because it shows us your train of thought too. Tell us a little bit. Yeah, go ahead.
Oh, I'm sorry. I was gonna say, I think it's what it really boils down to is that I am that constant person who is that person who constantly asks why, and it's really annoying, and I know how annoying it is. I understand how annoying I could come off, but but it's something that I need personally to do something. Is like, why are we doing this? And this is something that I push my teams to ask is, okay, I'm telling you to do this, you need to ask me why. right? And you need to get the full context of why, because if you don't know the full context, maybe what I'm telling you is the wrong thing to do, right? And and it's the why really starts getting into that problem solving, the critical thinking, the self-reflection pieces of like, what I'm doing, is this the right thing to do? Is there a better way to do this? And how do I how do I improve on what you're telling me to actually do?
No, I really appreciate that. And it shows in the way that you've been explaining it that it takes that balance and deep thought. It's not going to come by outside sources so much as taking deep reflection on what it is that's happening. Um, your your role now is commercial strategy and innovation, as you have it put on your LinkedIn profile. What is it that keeps you up at night? What are things that you twist and turn at night and does not let you sleep?
Well, I sleep pretty well actually, Tommy. I'm not gonna lie. I put a meditation track on right before I sleep at the same one. It just knocks me out. Um, just as
Awesome.
long as just as long as I plan for the 8 hours, I get that 8 hour chunk. I'm pretty good. Um, um, but actually, I have to say that I actually do feel like I am at a place now where I, um, um not a lot of things would necessarily quote unquote like phase me in terms of keeping me up at night, right? And the reason I say that is that there's always going to be challenges, there's always going to be like problems, but it's a different it's a shift in orientation of your mind of like looking at these problems as opportunities, right? It's an
Mm,
opportunity to do this thing. It's an opportunity to learn about this thing, and but then also not having too much pressure on yourself of like you as a single person do not have to have the answer to curing cancer.
right.
And I really struggle with that for a lot of years. I actually I had a really difficult time about 10 years back, and I basically had a psychotic break. I got to a point, it was a lot of things. There were a lot of things happening, and I got to a point where I just completely broke down. And one of the reasons was I had this overbearing feeling of the world's problems are on my shoulders.
Mm,
They are not, right? And every year since that, I've been learning how to handle these situations where I'm either reframing how I think about it, right?
mm,
Or where I'm reframing it to a place where it doesn't give me give me anxiety. Or it's I had a hard time I had a hard time reaching out for help, right? I had a hard time delegating. I had a hard time doing those things, and then I had to say, I don't have to be doing this. Someone else could be doing this.
yes.
My time is worth so much more doing this other thing or solving this other problem. I would rather do that. I can let go of my ego and let this other person do it.
Yes.
Right?
Yes.
Or this other person is so much better at doing this or has so much more context. I don't have enough, and I'm not an expert in this. I need to acknowledge that I'm not an expert in this, and I need to go ask for help.
Mm,
Right. And I think
yeah.
that there's a huge piece in a lot of this where it's just like you got to let go of your ego. And I think a lot of people have issues with that. Have trouble doing that. And it's not like, you go through school and people hand you a handbook on how to do it, right? No one goes through a course that is how to be self-reflective, how to not have an ego, right? Like that's
Right.
stuff that you have to learn on the fly. And unfortunately, I've had the opportunity to be around some really great people who were able to teach me those or at least exhibit those behaviors.
Yes.
Um, and I could learn from that. But I think but step one is you as an individual needs to want to do that first.
Yeah.
And then the opportunities will come.
I think that's such an important piece because we carry our pride with ourselves, but then there's a lot of negative talk in our heads too, and there's a lot of that park your ego at the door that brings so many good opportunities in life. And if we can just let go a lot of times of our own pride, because I think when we're younger, we admire people who are smart and right, like, oh, accomplished. But then as we get older, we tend to cherish more people who are kind, people who we can work with, people who we like hanging out with, right? And that maybe those are smart people as well in a very different way. I really like the way that you said you have to change your perspective. Otherwise, you let these thoughts keep bringing anxiety to you because you think you have to solve cancer. And the reality is that, oh boy, we have to work as a team. Many times we forget that we also need to be the employer that the employee wants to work with if we're hiring somebody new. And so I think that what you said is so crystal clear, and leave that ego, check your ego, and keep building towards a more, okay, being part of the milieu, right? Be part of the team. Any last words that you would say, Qing, that you think would be important for us to hear? I've appreciated so much your perspective and you telling us so much about Blue Agilis, I should say. And I think it's been wonderful conversation so far, but has there been something that I didn't ask you that you wish I asked you?
Um, no, I think this has been great. I think I'll just go ahead and leave you guys with my favorite quote, which is jack of all trades is a master of none, but oftentimes better than master of one. Um and so I definitely know I've had to learn to not be the smartass in the room because no one likes a smartass. um but also but also part of it is like, you could spend hours and days and your whole life on one thing, or you can explore, right? And I think my perspective, and I'm sure it's not for everyone, so take my advice with a grain of salt, but like my perspective is life's just so much more fun when you're doing more things, right? When you get to have the opportunity to do things that you never thought you would have considered, or the first word that comes out of your mouth shouldn't be no, it should be, how do I do that? Right. And I think the perspective that you gain from doing more things and exploring more things, or just trying new things, is you build up this database in your mind, and then when the time is right, you start connecting the dots, and then it helps you actually come up with better solutions in other contexts, right? And so that's I always say, if you get the opportunity, take it.
Absolutely. Absolutely. Who knows if that opportunity will come around.
Right.
And as you said, you're just building your tool belt, you're building your database, and making those connections will come at some point in time. It's been so great talking to you, Qing Li, the Vice President of Strategy for Blue Agilis in Indianapolis. Thank you so much for being our Pathfinder today. I'm looking forward to catching up with you soon as well.
Great, sounds good. Well, if you're ever in Indianapolis, or I live in Chicago, so if you're either in either places, definitely reach out, and we can meet in person.
Perfect. Thank you so much, Qing. Have a great rest of your day.
Great.
Bye-bye.
Bye.
Thank you for joining us once again, and remember to hit the like button and subscribe to our channel.